I absolutely believe we're doing everything we can do to make care more affordable and simple. It's part of our purpose as an organization, and I have 300,000 employees that are committed to doing the same.
Ms. Boudreau.
Congressman, we have two core priorities: to reduce the cost of care for the people we serve and to improve the simplicity in how to do business with us. We, though, believe that there is no simple solution, and we need to work together with everyone in the health ecosystem to do better, as I said.
Mr. Cordani.
Mr. Chairman, we largely serve the employer-sponsored market in the United States, and most of that business is self-funded or fully transparent, and we work every day to reduce the cost of care. Additionally, we just launched a new pharmacy benefit offering that is fully transparent, no rebate, no spread pricing, that will further improve affordability. So we work every day to lower the overall cost of health care or deflect the medical cost trend on behalf of our employer clients.
Mr. Markovich.
No, because it just costs too much.
Thank you. Last week, President Trump announced the framework for what he called the Great Healthcare Plan, with a major focus on restoring trust in the American health insurance system, requiring transparency in prices and justifying claim denials, disclosing what premium dollars are actually spent on, and holding middlemen accountable for shady kickbacks, and simply having you all communicate to patients in just plain English what they are paying for insurance, why and what coverage they get rather than hiding important details in the fine print. This mirrors and builds on what efforts Republicans in Congress have taken to lower cost and increase transparency for patients. This is a yes or no question for each of you. Will you commit to supporting legislation that supports the president's calls to truly bring transparency to health insurance, will crack down on fraudulent enrollments, and holds insurers accountable for their excessive prior authorization and care denials? Mr. Hemsley.
Chairman, we applaud the president's interest in this and focus. The ideas put forward could be part of meaningful change and solutions. We are aligned with the themes of those on transparency, accountability, addressing costs and improving the system. So we'd be supportive of that as part of a broad-based, bipartisan solution to move forward in healthcare.
Mr. Joyner.
Yeah, we share the president's and this committee's goal in reducing health care, simplifying it, using plain English in which to interact with the patients. So yes, we are very much aligned with this committee as well as with the president.
Ms. Boudreau.
Chairman, we support transparency. We also support many of the tenets of the president's policies. We encourage us to make sure transparency is also available through hospitals, and we have a priority across our company to simplify patients' ability to understand their coverage as well as the costs.
Mr. Cordani.
We support improving transparency, expanding choice, and aligning incentives, so yes.
Perfect. Mr. Markovich.
Mr. Chair, I support all the principles that you outlined, and I particularly want to point out that in my opening statement, I referred to kickbacks as an issue.
I did. I appreciate your testimony, Mr. Markovich, and your frankness. So clearly, we aren't all doing everything that's possible to lower cost and cost for patients and take accountability. And so by saying that you would support this reform, you clearly are admitting that there's a problem. We all know there's a problem. That's why we're here. It's a shame it's taken a congressional testimony for you all to commit to putting patients over profits. But we can do better. And we have to do better for the American taxpayer, the American individual who is just trying to get by to put food on their table, clothes on their backs, and gasoline in their cars. I recognize the ranking member.
Thanks, Chairman. Thank you. So since you raised the issue, Mr. Markovich, I want to give you some numbers. In Massachusetts, 98% of the adults in Massachusetts have health insurance. 99.5% of the children in Massachusetts have health insurance, and 99.7% of the seniors in Massachusetts have health insurance. So why did that happen? It happened because of a Republican governor, a Democratic congressional delegation, a Democratic legislature, the Chamber of Commerce, and the AFL-CIO, who got together and said, we've got to do something about the cost of health insurance. And by the way, what I've just described, polls in the 70s in terms of satisfaction, because we decided to work together, not to ridicule, not to scorn, not to mock, but to make it work for the American people and the residents of Massachusetts for sure. So I want to ask Ms. Young a question. You're here telling a pretty compelling story. It's becoming all too common for working Americans across our great country. You're a small business owner, breast cancer survivor, and someone who is struggling, as you noted, with rising health care costs. And thank you for mentioning part of the glue that held the ACA together. We ended pre-existing condition as part of the negotiation. How about keeping 26-year-olds on their parents' health insurance, which was a major issue for Americans across our country? Your testimony detailing the out-of-pocket cost increases that you're facing, shifting to high-deductible plans because our Republican colleagues refuse to extend these enhanced credits. You now have to pay $7,500 out of pocket, plus premiums, before insurance starts to cover your care. Almost 40% of the Americans in our collective family don't have $400 in their bank account for an emergency, and they're struggling to pay their bills every day while facing these rising costs and then trying to save for retirement. So the question, what does this cost increase mean for you, that you now have to pay insurance premiums and $7,500 of cost before your insurance starts paying for care? Because you now have to pay for more health care, how does that affect your other financial considerations, like that important matter of saving for retirement?
It affects them greatly because obviously as a small business owner, I have to save for my own retirement, and you start to weigh, do I pay for more health insurance or do I pay for retirement? Either way, I've got to make sure that I can take care of myself. And so I'm able to do both by having a higher deductible and out-of-pocket expenses, but it's just a tough choice. You start to think about the quality of food that you're going to get because something has to get cut. Unfortunately, when you start to think, can I have the same quality of food, it's a bad day. It's a bad situation.
I can safely assume you're in favor of extending the Affordable Care credits.
Absolutely, yes.
Thank you. I yield back my time.
Thank you, Mr. Buchanan.
Thank you, Mr. Chairman, and thank our witnesses for being here today. The U.S. is spending more, and we touched on this, more dollars on health care, and we're getting sicker as a nation. So numbers and things I've looked at, we're on a list of 66 and crazy different lists. So I just want to mention, in fact, CMS reported last week that we spent $5.3 trillion. We touched base on a 7% increase. Our expensive healthcare system is reacting to illness instead of prevention. And that's kind of where I come from. I really do believe that we've got to prevent things before they start. They said 95%, pick a number, of cancers, if you're caught in the early stages, you don't get into the terrible expense and all the things that go along with it. Our incentive system is backwards. I was in business for 30 years before I got here, and one of the most critical things you could do is set up the right pay plan with your employees and everybody else. That right pay plan should be making people healthier, and so you don't want to have benefits because someone's diseased and they come in more often. You want them healthy and go out. So we've got to set up the proper incentive. Our incentive systems are backward. Fee for service is set up to pay the number of services provided, not the outcomes, and the value to the patient. Premiums and out-of-pocket expenses have risen incredibly in businesses. As I mentioned, I was in business for 30 years, had my last company 1,000 employees, and I can tell you one thing, setting up the right pay plan, as I mentioned earlier, is really critical to that. But in doing a round table with about 30 of our smaller businesses in our community. I wanted to see where everybody were at on various issues, because I also, at the time, this is a while back, chaired the chamber. And I got to tell you, it was unbelievable in that room, out of 30 people, how many had little or no insurance because they couldn't afford it. One couple told me they were paying $3,000 a month. They own an Italian restaurant, $36,000 a year. How do those numbers work? So business, especially small business, we need to do more. It's just got too expensive. We must do better for the taxpayer, and the best way to bend the cost on the curve, in my mind, is affordability, is trying to get down where it's reasonable. But one of the things I've always talked to people about, you've got to be also, we got to encourage people in education, other things, to be the CEO of their own health care. That's really critical, because you can't, you know, I always tell my friends or people, if they're open-minded, not everybody's open-minded, get a physical every year in January. Start the year off right and figure out where you're at, make some tweaks and adjustment, but we've got to get into prevention. I've heard a lot of different discussion, but to me, at the end of the day, it costs you, you know, you hear people getting cancer in their 40s and 50s and 60s. A lot of that, again, is preventable. So with that, let me just ask Mr. Joyner, your thought. One of the things we were talking about is affordability. What's your thoughts on that? What were you suggesting? What can we do more to make everything more affordable?
So, Congressman, I have 100% aligned with the way you think about the healthcare challenges today. The health status of our population is not great. So the prevalence rates of heart disease, type 2 diabetes, and certainly the oncology cases that you mentioned, many of these are preventable. So we are very much focused on...
Someone I'll just mention quickly told me that 50% of people that have their first heart attack never see the next day. I walked out of that room and I thought to myself, this is a while back, I thought to myself, you know, that I want to be on that side of it, and that's what got me into the physical. But go ahead.
Yeah, so we have a prevention problem and wellness problem, but we also have an engagement problem. We have to get the population to engage in their health. So that's where you structure incentives. And you also use technology to help the member and/or the patients access their health care.
How can you get your patients more engaged, or have you had luck doing doing that? Because that's really critical, get them to buy in. Not everybody will, but there will be some that might.
So we launched a new digital app over the last year, and we believe that it is one turnkey solution that allows them to now manage all their health in one spot. The challenge today...
I only got about 25 seconds. Let me mention also we're promoting the idea of real food. A lot of this food is highly processed. There's no nutritional value. We've got to do everything we can for our kids. Kids today, they're claiming the obesity or whatever is at 20%, where maybe used to be 3 or 4%. So we've got to do more in that space as well. So what's your thoughts on that?
I think it's the whole health. So I think it is food and nutrition. I think it's diet and exercise. I think it's...
But what are you doing about it with your patients?
So today we want to align with the provider, so we set up a structured relationship so that the providers share in the outcomes. This is part of what we were talking about in terms of value-based care. But ultimately, it's when everybody on the care team is working towards the same common outcome, which is improving the health status of the patients, helping them navigate and deal with the complexity of the healthcare system. And we've actually made a difference. You know, the companies and the businesses that we run and operate, we've actually been able to lower cost and improve the overall quality of health care for those individuals.
Thank you. Appreciate it. My time's up.
Thank you, Mr. Doggett.
Thank you very much. Thank you for your testimony. Just as there's no miracle drug to cure every ailment, there is not a panacea to high health care costs. You're part of the challenge of addressing that, but hardly all of it, and how we end a system that costs Americans 2 to 4 times more than people in other developed countries for their health care, and yet we end up sicker with higher rates of obesity and chronic disease. I say you're only a part of the challenge because while there's much talk of fraud, fraudsters take advantage of an inefficient system and lax oversight by the Trump regime. More concerned with yelling fraud, as we have heard repeatedly here and on the floor of Congress, the regime and their enablers have been using fraud as an excuse for a cruel agenda of cutting access to health care for millions of Americans and blaming insurers. In blocking the affordability credits, Republicans pointed to a recent GAO study on fraud, ignoring the fact that the fraud which was reported was documented as committed by hundreds of insurance brokers, not a mother out there seeking care for her sick child. Yet it is the child that suffers when this GOP agenda of yelling fraud really means replacing Obamacare with nothing care. I renew the challenge that I have made here and in the Budget Committee that if these Republicans are the least bit interested in preventing fraud, look beyond these insurance executives. Instead, get in a witness from the administration, which you have feared to provide in public session, like Dr. Oz, who can explain perhaps why the Trump regime reinstated 850 insurance brokers that had been suspended for wrongdoing last fall by the Biden administration. Let's hear whether CMS has issued a single civil monetary penalty for fraud, whether they are holding insurance brokers accountable in any way. While Trump won't offer a penny of help to families struggling with marketplace premium hikes, he continues to pardon healthcare fraudsters and deny their victims restitution. It's essential that the Senate pass our Democratic bill to restore the tax credits, and the claim that he has some great health care plan is as phony as the dimensions of his plan over the last decade or so. This is simply a plan to shift money to insurers from one account to another. He claims he can give the money directly to the consumers, but a company like United, Mr. Helmsley, is not limited to Obamacare policies. You have high deductible plans that you sell with health savings accounts. You have certainly Medicare Advantage plans, as many of you have, which I understand is perhaps the most profitable sector. And taking the money out of affordable health care credits and shifting it there is not going to change the status necessarily of insurance companies, but it will certainly hurt consumers. And if you want a real example of waste and abuse, I think it is forcing Americans to pay for Medicare Advantage premiums for military veterans with the Veterans Administration actually providing the medical care. Yet the VA is prohibited by law from collecting a penny from any of your companies. That's a great business. An insurer collects the premiums, but the VA at taxpayer expense provides the care. Unfortunately, my bill to put a stop to this nonsense, like other anti-fraud bills I've filed in this committee, cannot even secure a hearing. Mr. Helmsley, on a more constructive note, I would ask you one very narrow question about a distinguished surgeon in my community of Austin. Dr. Elizabeth Potter and the Red Bud Surgery Center are located there in Austin. She's been unable to obtain in-network status with United Health. She spends hours negotiating authorization to perform surgery at nearby hospitals, which lack the level of equipment and safety that she could provide at a fraction of the cost of the hospital. I know you have many responsibilities. I would simply ask you to commit to personally investigate this situation, give you your folks the name and address, and engage in good faith negotiations and report back whether this matter can be resolved.
We will do that, Representative.
Thank you very much, and thanks to all of you.
Mr.
I would ask, Mr. Chairman, unanimous consent to put into the record my request to Dr. Oz to answer these questions about the fraudsters, which he's been unable to answer for months.
Without objection.
Thank you.
Mr. Smith.
Thank you, Mr. Chairman. Certainly thank you to our witnesses for voluntarily appearing here today. I think we are having conversations that need to be had, and I hope that we can work together for constructive solutions, that we can share thoughtful ideas, that we can recognize that I think everyone on this dais wants our country to do better by the people as it relates to health care. There are, I don't have to tell you, there are glaring problems that we face. Incidentally, Mr. Joyner, thank you for mentioning my bill, ECAPS, Ensuring Community Access to Pharmacy Services. I think that's one way that we could increase access, utilize the expertise of highly trained medical professionals more efficiently and effectively, and certainly as it would benefit the seniors and that access, both rural and urban. And I think of just the, various descriptions of the problem at hand here of high premiums. Now, I had someone describe the situation of the subsidy as we're shoveling government subsidies to paper over a problem. That's true. that it really, I think, conceals the problem at hand. I mean, I think back to before the ACA, the so-called Affordable Care Act, that we had the high-risk pool for those with pre-existing conditions, and now that seems like a bargain compared to what the individual market is having to pay. And there were signs, as all of the debate was happening in the run-up to the so-called ACA, there were warnings that we better be careful in what this is going to do to the individual markets, and here we are. Now, we've been learning a lot over the last couple of years, especially, but I'm concerned about just the abuses of the system, and perhaps whether someone might want to call it fraud, someone might want to call it unintentional enrollment. The results are the same. And we know that there's a large number of folks who have recently been eligible for zero premium plans. And recent studies have shown that in 2024, nearly 12 million ACA enrollees, up to 35% of all enrollees in ACA, did not log any claims or use their plans at all during the plan year. Now, I would like to think that there was absolutely no need, although I think it's generally a good idea to at least get an annual physical. But I'm genuinely curious, Ms. Boudreau, do we assume that many folks, 35% of those who are enrolled, are just so healthy that they don't need to see a doctor at all?
Well, thank you for the question, Congressman. As we think about this overall, insurance is used for protection as well as use. So our numbers, I share your concern about potential fraud and catching that and making sure that we have integrity in the eligibility process. Our numbers show that it's roughly around 15% in total that we get our enrollment from the exchanges, both federal and state. The state exchanges we work directly with and do a bit better. But again, we share the issue of integrity, marketplace, integrity around ensuring that eligibility has people eligible for these are in those programs, as well as we think a stable program requires continuous coverage, requires us to be able to deliver preventative care. And so those are all really important pieces of keeping.
Right. Certainly the fundamental concepts of pooled risk are important, and I hope that we can have a good conversation about that too. Now, with all of these debates and various data points circling, I did come across some data here that Mr. Cordani, I'm turning to you to perhaps offer some background and explanation. Now, it seems apparent that in 2024, your company, obviously, as most did, took a rate increase. I think one state under your plan saw a 40% premium increase. Now, in the earnings call on January 30th, 2025, you said that in 2024, that you returned $8.6 billion to shareholders through dividends and share repurchase. That seems glaringly imbalanced in terms of what needs to be done for ratepayers, ultimately health care, and certainly shareholder priorities. How can you give us some background there? And because on the surface, it seems like shareholders receive great benefits, certainly at the considerable expense of patients.
Congressman, thank you for the question. Two different points. One, I think your initial comment is relative to the exchange business in the year you identified. The year prior to that, we lost a significant amount of money in that specific state because we had an inordinate amount of growth.
Okay, so other states perhaps a lower increase, but certainly
lower
still an
increases,
increase.
but meaningful increases. Point two is we've been in the Obamacare exchanges since its inception in 2014, and we've only been profitable in 2 out of those cumulative number of years. To your broader point, the ability to purchase back stock in that time frame was aided by divestitures of businesses. So we, over the last 5 years, we've divested several businesses, as well as successfully have been able to run our largely employer-sponsored business. So I would ask you to disconnect the purchase of stock heavily correlated toward divestitures and operating cash flow. We have not made money in the exchange business for quite some time. And in the United States, the vast majority of customers we serve are in the employer-sponsored market and in a self-funded way.
I understand that, and my time has expired, but I'm concerned about the employer-sponsored market, especially public sector, where expenses have gone up and coverage has gone down. Thank you. I'll yield back.
Mr. Thompson.
Thank you, Mr. Chairman. Thank you to the witnesses for being here today. I think it's pretty clear that too many Americans can't afford the insurance they need to even see a doctor, and this has got to change. Last year, congressional Republicans cut $1 trillion from Medicaid, and they failed to extend the enhanced premium tax credits to make insurance more affordable for middle-class Americans, all while they added over $4 trillion to the national debt to give a huge tax cut to corporations and some of the wealthiest people in our country. Now, 15 million Americans are losing their health care coverage. Some clinics and hospitals have already closed. More will be forced to close their doors this year. And I'd like to submit this article outlining some of those closures to the record. Congressional Republicans also failed to extend the Affordable Care Act's tax credits, and hardworking Americans' health care premiums just doubled or even tripled in this new year. You know, I've supported Medicare Advantage. But some of the actions by some insurance companies, some that are here today, are very, very concerning. And I have 3 articles I'd also like to submit to the record, Mr. Chairman, on that issue.
Without objection.
These articles show that insurers are abusing Medicare Advantage. In one disturbing example, the Wall Street Journal noted Medicare Advantage companies are exploiting our veterans. And thank you, Mr. Doggett, for your legislation. If I'm not already a co-author, please add me to that. I'm a combat veteran, and I use the VA services myself, and I get great care from them. But many of my fellow veterans are preyed on by insurance companies who get them to sign up for Medicare Advantage programs, despite that the veterans get all of their care from the VA, and they're not reimbursed. VA is not reimbursed. According to the Wall Street Journal, 1 in 5 veteran members of Medicare Advantage plans did not use a single Medicare service in 2021. Care provided at the VA is not billed to Medicare Advantage plans, which means your companies are collecting taxpayer dollars without providing a bit of care to many of our veterans. 82%, I want to talk about prior authorization because it's also concerning. 82% of physicians reported that patients abandon needed treatments because prior authorization requirements are too burdensome. The American Medical Association says that authorization delays have led to serious adverse events for their patients. And according to the California Hospital Association, nearly 2/3 of prior authorization denials are overturned on appeal. Prior authorization increases administrative burden and for our doctors, and it's bad for our patients. And that's something that I believe you can do something about. So I have a question for all of you. Prior authorization is causing these problems, and many of your companies use AI algorithms to categorically deny care that must then be appealed without the input of a physician. I want to know what you're doing about that and how you can address it. And Mr. Hemsley, we'll start with you and go right down the line.
Thank you, Representative. I think that is a great topic to bring forward. Our organization is focused on making the complexity and disruption of prior authorization much smoother and much easier. We do not use AI for anything other than administrative purposes. It is not applied for clinical applications whatsoever, and we are advancing an effort to really make the authorization real-time and digital. Less than 2% of our total interactions require any authorization at all, and the overwhelming majority of those are administrative. Those are usually resolved. They are usually resolved by a document or something like that.
We're quickly running out of time, so if you could hurry along, and
Well,
everybody can
only
get a word
that
in.
we are definitely in alignment with you on this. We would like to make this much more intuitive, simpler, modern, and we are on that course. We have 4 projects in the market today piloting this effort, and we also want to bring it to the rural community where we think we can expedite the flow of funds and bring some relief to those communities.
Congressman, we agree with you. We do not use AI to deny care, and we also believe that there are opportunities to improve the prior authorization process. We're committed to it, both reducing the numbers as well as improving the data sharing with the providers to take the patient out of the middle.
We also do not use AI to deny claims or to deny prior authorizations. We also have clinicians involved, and we are committed to continuing to improve in the commitments we made, and we want to share data with care providers to make this safer, more affordable, and more connected, and we think there's a big opportunity to do that.
Congressman, in the commercial business that we operate, in excess of 95% of all the claim experiences have no prior authorization. For those that do, we've been able to successfully use AI to get to yes rapidly, and now we have almost 78% of all those prior auth that need to transpire taking place immediately, but it is never used for a denial.
We have not and will not use AI to deny care. Prior authorization process today sucks. We all take accountability for it. We are fixing it by reducing the number of services that are covered, offering an online service, and standardizing electronic submission of data.
Thank you. There's a disconnect, Mr. Chairman, because the doctors that I talk to and hospitals I talk to are telling me something a little bit different. So I'd welcome the opportunity to work with you to figure this out and see if we can fix it. Thank you. I yield back.
Hopefully in the future, we'll be hearing from those doctors as well to get to the root of the problem. Mr. Kelly?
Thank you, Chairman. And I want to thank you all for being here today. I know your morning started off in a real pleasant launch as people start to talk about what they're paying for their health insurance, healthcare insurance. One of the things I want to bring out, everybody talks about healthcare, the prices are going up, and healthcare insurance, the prices are going up. Taxpayers and hardworking Americans are all footing the bill. Before I got here, I was a car dealer, and we knew that insurance was an essential financial product. Now, no one could drive off the lot unless they had insurance on their car. And I think we're getting to the point where anybody in life today doesn't even want to get out of bed in the morning if you don't have some kind of health care insurance that's going to take care of you if something goes wrong. Now, the need for insurance it is more about the confidence that any illness or injury does not lead to a financial catastrophe. Now, affordable health insurance remains the cornerstone of competitive benefits package, serving as the primary driver for employee retention and the most crucial factor in a worker's decision to accept or stay with an employer. My son now operates our family dealerships. We started back in 1953, and over that time period, we've had thousands of people on our team from time to time, and we've always tried to do the best in their interest as far as products that would help them, not only while they're with us, but also when they retire, that there's something there for them as well. Now, when I was talking to Brendan yesterday, I said, you know, I haven't been following it as close as I should. What are we paying for our health care insurance right now? Because, yeah, we just got done talking to our agent. It's going to be $1.5 million this year. Now, $1.5 million used to be a lot of money. And to some people, it's not. To me, it's huge. Now, the average American family plan costs a total of $27,000 a year. Unless somebody says that's enough to buy a reasonably priced nice car, I would debate that with them. There are some easy fixes that Congress could enact to make health care more affordable, more transparent, and more valuable. And I have introduced legislation called Improving Seniors' Timely Access to Care Act with my colleague Susan Delbaney. Mr. Thompson, thanks for your comments, because that's exactly what we're talking about. This bill would make necessary reforms to prior authorization and Medicare Advantage. Lawmakers on both sides of the aisle, hundreds of health care organizations, and Americans from all corners of the country agree. Streamlining this process will allow our nation's seniors to receive the care they are entitled to more efficiently. This legislation modernizes the entire approval process to ensure seniors receive life-saving medical care that they have already earned. This bill has passed Ways and Means twice and has passed the House floor in previous Congresses. This bill has over 240 co-sponsors and numerous endorsements, including the endorsement of CVS Health. Now, Mr. Joyner, thank you. To our other panelists, I would like you to please look at this piece of legislation. If it makes sense to Mr. Joyner, you're all in the same business, it would probably make sense to you all too. So please take a look at that. We have a lot of support on this, but we can't get anything done until we actually get it done. Look, I don't know of another country in the world that spends more money on health care. And because of health care being expensive, health care insurance is expensive. I know in my own business, the more expensive product you drive, the more expensive the insurance is on that. The only thing is you can't leave the dealership without having insurance on that. What we really need, so when you heard about the piece that Mr. Joyner was on, I'd like you all to take a look at that and endorse it so we can put that on the floor again and get it passed and start making some progress in this. I want to thank you all for being here today. I know that at times, I witnessed years ago whenever Congress decided to bring the automakers in and criticize them very heavily because they flew in their own private jets. And they thought that anybody flying a private jet shouldn't be coming to Congress asking for taxpayers to support them. I think we've reached a point, if we can get by being political and talk about good policy. This isn't about President Trump, it's not about President Biden, it's not about President Obama, it's about the American people and having health care insurance that they can afford, and that they can get the health care they need when they need it without having to bankrupt themselves. So I would just ask you, please, you're in the business, and it is a business, and it's all math. When I look at the numbers, I say, these numbers look really, they're staggering. It looks like you're very profitable. I don't know what your net is. I know what the big figures look like. It's like, God, you had a hell of a year. I don't know what you netted out of it, though. So the only thing I'm asking you, and I think the whole committee's the same way, let's make sure we're working together to get the right kind of health care insurance for the people that we represent every day. I do not represent 750,000 Republicans. I represent 750,000 Americans. They're looking to us to get with you and make sense of what the most expensive thing in their life is. Chairman, thank you.
Thank you. Mr. Larson.
Thank you, Mr. Chairman. And let me start by saying thank you, Mr. Kelly. You know, it's always refreshing in the committee to hear candor in a speech like that. And this is about the American people. And I'm again want to thank our witnesses for being here. Something preliminary that I'd like to get to. One of our colleagues asked, Mr. Markovich, they asked about the issue of people who don't use services in a year somehow being fraudulent. This is something you mentioned in your written testimony. Could you take a brief moment to discuss that point?
Well, on average, in any population we insure as a group employers, probably 20% or a little more than 20% of people don't have a claim in a given year. And in California, in the Affordable Care Act, we had approximately 18% who didn't have a claim. So we haven't really seen a big difference there. The last thing I'd say is that we work closely with Covered California to institute things like dual-factor authentication, and so we are not seeing evidence of fraud in that state.
So it's not fraud?
Well, not in California.
Right. All right. Well, listen, thank you, Mr. Markovich. I also wanted, Mr. Chairman, to submit for the record, first to associate myself with the remarks of Mr. Neal, and I wanted to submit for the record this district court opinion from Maryland. And the opinion has to do with something we've been calling for on this side of the aisle, which are hearings, frankly, like this one, where you're candid and people get to ask questions. It's a very simple thing that we're asking for also. We wanted Elon Musk and Doge to come before the committee and talk to us. Imagine they don't have to talk to anybody. They are in every one of our agencies, but most notably Social Security, something all of you are familiar with. And they're there going over people's personal information. And this report by the Trump Justice Department says that those individuals have given information. Something we have been saying on this side of the aisle is why they should be prevented. To her credit, Trump's appointee said, I would rather resign my position than allow people to have access to the personal data of more than 300 million Americans. She was asked to leave and was replaced temporarily by an individual who, in fact, had already been suspended because he had given information to private sector agencies. He was the person who was interim before our current SSA. This screams and demands this committee, like we're sitting here today, to sit with Doge and Elon Musk and Mr. Davis and ask those very questions about what has happened. You're going to be grilled on questions of what you're doing today, rightfully so. And I commend our colleagues, and I commend the chairman for saying that there's going to be further discussions, bringing in the hospitals and the doctors and all the costs. I wish we could say we had a plan from the other side, but we don't. But if we're going to be having hearings and we want to be candid and get to questions that need to be answered and actually work together bipartisanly for solutions, then we need to be able to honor a member's request. We have something that's called a resolution of inquiry that should provide this. Mr. Musk was able to avoid that because he's above the law. No one's above the law. We need answers to these questions. Thank you for being here to answer tough questions. I yield back.
Thank you, Mr. Schweikert.
Thank you, Mr. Chairman. All right, let's have some fun with some math and plan design. And Mr. Hensley, I'm going to direct most of this to you just because you are truly your organization's the biggest player in the space. We've been working on Medicare Part C, most of us know it as Medicare Advantage. In many ways, dollar-wise, it is multiples of the debate of more subsidies on top of subsidies. This is the MedPAC report, and I know we all argue about what it actually says, but for a decade, I have in here, basically it's saying, and I'm sorry, but we've read it a lot, so it's falling apart, that Medicare Advantage is coming in at 120% of fee-for-service. If you go back to 2005, when we actually started Medicare Advantage, it was supposed to come in at least 95% or less. Is there a way, an organization like yours, where you have very robust networks, how do I actually take a look at the externalities? And look, we're blessed to have a Bloomberg terminal, so we pulled up, your reports and those things, $9 billion to AARP. We've been trying to calculate what you pay to brokers, externality costs that don't actually provide healthcare service directly to that enrollee. If I came to you and said, let's go back to the original design, Senator Frisk, 2005, where it's a managed care model, but the profitability comes from helping your population be healthier instead of scoring them as sicker, or some of the craziness that goes on in the star ratings and some of the changes that happened during the ACA, where in many ways they screwed up the incentives, and go back to a classic model of actuarially bid your population, build a model with government so we have some risk sharing if there's an externality of individuals who are remarkably expensive, so you maximize the efficiency in your bid. How do we clean it up? Does it require multi-year enrollment so you can invest in the person to help them get healthier, help them with their BMI, whatever it is? How do we make Medicare Advantage work? And this is for the members of the committee. I know you've all read it. Over the next 7 years, Medicare doubles in cost. We go from $1 trillion to $2 trillion. In 6.5 years, the trust fund is gone. The Medicare trust fund is gone in 6.5 years. That should terrify you. Are you, when you realize how much of the Medicare Part A trust fund actually goes to the Medicare Advantage population? Am I just rambling, Mr. Hensley, or is this something that your actuaries, our economists, we could build a model? Because our CBO says it's like 1.8 trillion in savings over 10 years if we could just realign the incentives.
Well, actually, I applaud your interest in this, and I think it's very consistent with the spirit of others who have talked about really getting to solutions and getting to a better healthcare environment. And the Medicare program is so important. Medicare Advantage is, as you know, a very, very popular 95% approval rating with seniors. It is, seniors are opting for it. We do take issue with the MedPAC report and believe that the cost of Medicare Advantage is actually about 91% of fee-for-service Medicare. But I would be very open, and I'm sure the industry would be open to exploring ways to make Medicare Advantage more effective and more impactful. We already pursue value-based care as the predominant way we approach that, which is a payment for outcome, and holding care providers accountable for the quality and the status of those that we entrust to their care. So I would respond generally that we would be very open and constructive. Over the years, we have offered a number of ideas, and we would like to continue to bring those kinds of things forward.
Mr. Chairman,
Working
Mr.
with
Hensley,
CMS.
my crazy request is I am blessed with the Joint Economic Committee to have a couple healthcare economists. Send me a couple of your actuaries. Let's see if our math works, because the scale of spending and what we're up against debt and deficit-wise, because we've turned healthcare into financial engineering. That's most of this discussion here. It's not healthcare. It's who pays, who gets to be subsidized. I'm passionate. I want to revolutionize the actual delivery of healthcare so it's effective, affordable, and accessible. And that means making it about healthcare. So with that, Mr. Chairman, I yield back.
We align to that spirit completely.
Uberize healthcare. Mr. Schweikert. Mr. Davis.
Thank you, Mr. Chairman, and I thank all of our witnesses for the answers and comments that you have made. Ms. Young, I listened intently to your testimony with a great deal of interest, and one of the reasons that I did so is because you shared with us personal, real-life experiences. No projections, no analysis, but the real experiences that you have shared. And I certainly agree that there are no simple solutions to very complex problems and complex circumstances. But I do believe that we live in a country that has the wealth, the technology, and the resources to make sure that every citizen has the opportunity to have good, solid health care that they can afford. And that if they can't afford it, then it ought to be provided to them anyway. And I know that may be a novel idea in the minds of some, but even though we are a capitalistic country, I still believe that we're able to do that. We've made some progress, certainly over the last 50 years or so. And so we're not as bad off as we've been. But can you think of anything that would take us closer to this goal? Or what can we really do? I mean, we discussed the issue, but what do you think we can really do to try and make health care more accessible to the average citizen in our country?
All right, thank you, Mr. David. So my thought on what can be done is, instead of looking at taking away benefits that really do benefit, like the premium tax credits, those benefit many people. And even though the ACA may not be perfect, instead of trying to dismantle something that is really working for millions of us, work together in a bipartisan manner to fix the things that are not perfect, but don't take away what's really helping so many of us. So I believe if we have the legislators working together in a bipartisan manner, forget all the Democrat, Republican, and everything in the middle, and then when we have health insurance companies and working with the drug companies and the doctors and everyone working together, because right now everyone it seems to be looking out for what's in their own personal best interest instead of the interests of regular Americans who put each person here to represent us.
Thank you very much. And quickly, if I could ask each one of our corporate executives, just one sentence or one thing you think we can do to really make it more accessible. Mr. Hemsley, would you start?
Yes, thank you, and I very much appreciate the spirit in which you framed this. I think really if you could listen to everybody who testified in their prepared remarks, everyone was in favor of changing the incentives towards outcomes and value. Nobody went in another direction. You've got consensus about a change in the direction of how we incentivize and pay for care, and it was also in the remarks of several that were made before we began. So I would say really getting behind that kind of a movement and really building the healthcare system around those themes. I actually believe most of the companies here have already started in that direction.
Thank you very much. Our time is going to expire, so I'll yield back, Mr. Chairman.
Thank you. Mr. LaHood?
Thank you, Mr. Chairman, for having this hearing. I want to welcome our witnesses here today. As I travel around my district in Illinois, central Illinois and northern Illinois, I continually hear about the rising cost of health care from families and farmers and workers and small businesses throughout my district. Premiums and out-of-pocket costs continue to put pressure on household budgets, and too many of my constituents feel like they're doing everything right but still falling behind. While our healthcare system and its costs remain complex, and we've heard that today, health insurers play a critical role within our system. By pooling risk and negotiating on behalf of millions of Americans, insurers shape what care patients can access and at what cost. Ultimately, I believe competition and transparency and innovation are the best tools to lower costs and improve care. But when markets become unreliable and manipulated, we have seen that those benefits don't always reach patients. Much of your testimonies here today address factors other than insurance practices for the rising cost of health care. However, I view this as a comprehensive system where everyone shares responsibility to patients and families. We've also heard a lot about consolidation in health care and health insurance, both vertical integration with PBMs and medical practices, as well as large-scale horizontal consolidation of insurers, and its impact on patient choice and prices. In theory,
This consolidation should make it easier to obtain lower prices from providers as your market power increases. Mr. Helmsley, my question is for you. United Healthcare covers roughly 53 Americans across this insurance business, across its insurance businesses, and processes hundreds of billions of dollars in medical spending each year. You are the largest purchaser of hospital and physician services in the country. What challenges do you see as preventing you from lowering prices during negotiations despite your sizable and increasing bargaining power?
I'm sorry, that's an excellent question, and one in terms of real market reality. Our presence in the marketplace is leverageable in terms of getting good price and value for healthcare, but there is meaningful concentration in some markets, and you need to provide sufficient access. So to achieve that level of access, where there is concentration on the care health services side, health delivery side, there's only so far you can go so that you can make sure that people have the resources to go to for their care. And that creates a practical limit in terms of what you can do from an economic point of view.
I want to switch to Medicare Advantage. Medicare Advantage, as we've heard from a few of my colleagues today, has become a popular choice for millions of seniors because it offers coordinated care, predictable costs, and additional benefits that traditional Medicare often does not. When it works well, it can deliver strong value for beneficiaries and taxpayers alike. At the same time, issues have been raised ranging from allegations of improper practices like upcoding to real-world challenges seniors face navigating enrollment and coverage changes. My office recently assisted a constituent whose approved surgery was put at risk because of confusion about open enrollment and conflicting plan information, requiring my staff's intervention to avoid a lapse in coverage. Unfortunately, that is not a unique experience. These kinds of situations underscore how important clarity, accountability, and patient-centered administration are in Medicare Advantage. It's our responsibility on behalf of millions of Americans who have chosen Medicare Advantage plans to prevent this and address faults within the program. I ask this for any of you on the panel that wish to answer. What steps are you taking now to ensure Medicare Advantage continues to serve as a valuable and affordable option for American seniors? Not all at once.
Well, I'd go back to the points that I was making about getting a digital health record, changing the payment models to pay for outcomes, eliminating kickbacks. So the things I mentioned about Blue Shield of California members now can access a digital health record, which is what we're using to do the automated prior authorization, and we have gone to our own pharmacy model, which has saved some money. So there are some things that we are trying to do, and I do believe, and I'm happy to work with you, Congressman, on things that we could potentially change in the rules of the program to help support that.
Anybody else?
Again, I would use value-based care as the principal direction for Medicare Advantage.
Thank you. I yield back.
Ms. Sanchez.
Thank you, Mr. Chairman. I want to begin by thanking Ms. Young for taking time away from your business to be here today to testify about many of the experiences that I think millions of Americans go through in trying to keep their health care coverage. For our other witnesses, I want to say that it's no secret that Chairman Smith called you all in today to try to blame and distract from the fact that Republicans have cut health care coverage for 15 million Americans. 230 Democrats and Republicans, including 3 Republicans on this dais, voted to stop Americans' health premiums from doubling or tripling. So instead of pointing the finger at other folks, I think perhaps my Republican colleagues should look in the mirror when they talk about accessibility to health care coverage. Mr. Helmsley, I'm going to begin my questions. You announced today that you are reinvesting your profits to reduce premium increases for United patients this upcoming year in order to stave off the Republicans' failure to extend the ACA tax credits. Is that correct?
Thank you for bringing that up. We believe that given the desire to achieve coverage that you are really gathered for, that in that circumstance, as you seek solutions, that we would forego profits and rebate them back.
So the answer is yes.
Yes.
Thank you. Mr. Credani, will Cigna also reinvest its profits to lower patients' skyrocketing premiums costs due to the failure to extend these tax credits? Simple yes or no will do.
Congresswoman, thank you for the opportunity. Today, we cover about 1% of the exchange lives, and we do not intend to make that commitment. As I noted, we've lost money every year, but 2 over the last 12 years.
Okay, but Mr. Credani, respectfully, you were compensated $23.3 million last year. And what I'm seeing is perhaps the beginning of an industry-wide trend or commitment to try to ensure that patients don't go without health care. Is your answer still no?
Congresswoman, we made a pledge recently to reinvent the PBM offering for the marketplace, and it's going to reduce our earnings by $500 to $600 million next year. We've made that commitment. That comes out of every executive's opportunity next year. That will affect all the lives we serve, including those on the exchange, and we estimate that it will improve costs for every individual out of pocket. So we were seeking a much more scaled solution than for just the 1%.
I believe the answer is just still no. Ms. Bordeaux, will Elevance reinvest its 2025 profits to stave off the premium increases due to the failure to extend the ACA tax credits?
Congressman, we are willing to look at any proposal, but I just want to be clear on expectations because as we've been discussing, this won't address the root causes of what drives premium up, which is the cost for services and the continuity of care. We also did not make any money on the individual exchanges in 25, and we don't know how 26 will play out. So again, we want to be part of the solution, but want a meaningful long-term solution as well.
Yes, but Ms. Bordeaux, isn't it true that Elevance reported a $50 billion operating revenue this past year, primarily due to Medicare Advantage? I get the exchanges maybe not so profitable, but Medicare Advantage seems to be doing pretty well for your company, and your salary you personally made about $20.5 million, and none of that can be reinvested to help patients keep their health care?
Congresswoman, again, we are very interested in being part of the solution. Medicare Advantage, we also made a very minimal profit, not to the revenue you cite, and it's a highly regulated environment, very competitive. We seek, again, premiums a result of the costs that we pay underlying to support services and the members in those programs. We're looking at
so then I take it
sustainable solutions, and again, want to be part of that solution.
Okay, I take it the answer no. I want to pick up where my colleague Lloyd Doggett discussed denials. It's outrageous to me that over 80% of prior authorization denials are overturned. I think that plans should be penalized for these inappropriate denials. I just want to give like a very quick personal experience of that. I had knee replacement surgery earlier in the year last year. Was supposed to start in-home physical therapy immediately. Had my own challenge being in pain and on pain medication with my insurance that denied me the in-home physical therapy, although my orthopedist and every nurse said that it was critical to begin the physical therapy right away. And I'm a member of Congress and was on the phone battling with my own insurance company, which, by the way, members of Congress, to dispel any belief out there that we have the best health care in the world, I buy my health care off the DC exchange. I think that the prior authorization denials and then the fact that they get overturned on appeal so frequently means that these denials are purposely denying claims so that they're forcing people to prolong their care, which leads to worse outcomes. And I think that that is something that we really need to address. All of you need to really help address that. And with that, I will yield back to the chairman.
Thank you, Mr. Arrington.
Thank you, Mr. Chairman, panelists. Very concerned about the rising cost of health care, like everyone in this country. As the budget chairman, I have the honor of representing my colleagues in that role, and there's no way we're going to reverse the curse and change our fiscal trajectory that is completely unsustainable if we do not address and bend the curve on the cost of health care. It's crushing our families. It's a drag on the economy, and again, it's a threat to my children's future, and we've got to do something about it. A third of the federal government's budget is health care. 50% of all health care dollars are controlled by Washington, D.C. In the 80s, it was only 30%. Obviously, medical inflation is outpacing all other goods and services exponentially, and it's unsustainable. One benchmark for the American people to get a sense of this explosion in cost, we spent $19 billion in 1975, around 5% of the federal budget. Today, we're spending almost $2 trillion on health care, and it's a whopping 1/3 of the budget, as I mentioned. We've got to do something about it. We have to get the incentives right. We need the partnership with the private sector. I agree with my colleagues, competition, choice, transparency. I mean, no central planning here or anywhere is going to deliver the kind of value that you can deliver if we put the incentive structures in place and guardrails so that everybody wins. But I don't believe that that balance has been struck. I want your expertise, your insurance market expertise on Obamacare, because I do think that one of the problems with these perverse incentives have been directly flow from the creation of these tax subsidy, regulate, mandate programs. This was pitched, sold as the Affordable Care Act. Premiums and deductibles have doubled since the inception of Obamacare. Shake your head up and down if you agree with that. Raise your hand if you agree that they have doubled premiums and deductibles since Obamacare, the inception of Obamacare. Okay, everybody, okay, because it's just math and it's just data. And when you add the subsidy to this from COVID, which doubled the cost to the taxpayer, by the way, didn't double the number of people that were getting this insurance. In fact, if you deduct the 6.5 million people that are inelibly on the program, maybe it's 1/3. Do you know how much, on average, the premiums have gone up on the exchange since my Democrat colleagues doubled down on the, quote, Affordable Care Act? Twice. So, Mr. Hensley, is Obamacare, are the cost within Obamacare more or less than the inception, than when Obamacare was first passed? More or less?
Representative, the cost of all health care has increased.
But has Obamacare's premiums gone up twice as much as those in the private market and with employer-sponsored insurance? Have they outpaced the private sector and employer-sponsored insurance plans?
I can't say they've outpaced.
Well, does anybody know the answer to that question? You don't know the answer to that?
Well, Congressman, in California, they haven't been dramatically different, but I can't speak to it nationally.
Well, we have 6.5, according to CBO, 6.5 million ineligible people that are being subsidized by the taxpayer, that are not legally eligible. By the way, there's also billions of dollars in fraud. There are dead people's Social Security numbers used to send the subsidy to your insurance company. And everybody else up here, my question is, do you know that fact? And if you do, what are you doing to stop it so we can steward tax dollars, so we can make sure that the subsidy, as much as I think the underlying policy is flawed, is at least going to the people that it was intended to? What are you and your company, what are y'all doing to increase program integrity, prevent fraud, waste, and abuse of tax dollars?
Well,
6.5 million ineligible people.
Fraud is unacceptable everywhere. I'm proud of the work we've done in California, where we've implemented things like dual-factor authentication to verify eligibility. So we have not seen that kind of fraud issue at that level in California. And I'm happy to talk also offline about the things that we've done, I think, that have led to that result. Again, I can't speak beyond our market, but that's our experience.
And I'm not picking on you, quite frankly. It's across the board. Somebody's not putting the controls in place and paying attention. And we've got to change that incentive structure for the sake of the taxpayer and our future taxpayers who would be our children. So with that, I've gone over my time, Mr. Chairman. Thank you. I yield back.
Thank you, Mr. Arrington. I want to inform members that the votes have been called on the House floor, and I intend to call a recess following the end of my questioning period. Committee will be called back in order immediately following the vote series. I recognize myself now for 5 minutes. I had brain surgery myself 5 weeks ago, and I don't care if I was on dialysis, if I had an LVAD in, or if I was intubated, I was going to be here. I have been a physician for 35 years, and sadly have had a front seat to witness the decay and decline of one of America's largest industries, and that's the health insurance industry. I have had patients cry in my room. I have had physicians cry to me, throw up their hands in disgust, and quit because of actions of our health insurance industry. Nothing you're going to say to me today is going to change that. You have put profits above patients, and you've put profits above those who care for patients. You're sitting here blaming hospitals, pharmaceutical companies, even physicians. There is blame to go around there. But you have squarely abused your privilege of authority to deliver health care to patients in this country. There are a few bad actors a few good actors in the industry. Mr. Markowitz, I believe you're one of the good actors. If it were up to me, I would throw out all for-profit systems in this country and turn everybody into nonprofit. It has gotten that bad. But you all have been very derelict in your duty and abused this position of authority. There has been systematic denial and delay of care. It took me 8 denials myself to get a medicine that I need to exist. A year and a half. I'm a physician and a member of Congress. It took me 8 times through CVS to get that medication. I didn't pull any strings. I did what I was supposed to do. Imagine the average person in the country. There's been a weaponization of prior authorization. You are killing people who are trying to deliver health care. There's been abuse with the Medicare Advantage plans. My God, I could talk about that for hours. Deceiving and extorting taxpayer dollars. The vertical integration that has occurred in this country is disastrous and criminal. There have been record profits. I don't want to hear about the fact you're not taking profits. We know how money gets moved around in these companies. The C-suite executive salary compensations is a slap in the face to the average American who goes bankrupt because they cannot afford health care. You all showed up last summer at HHS and you said to Secretary Kennedy, a mea culpa, yes, we've been doing things badly, we're going to fix things. I won't believe any of that until I see it, and so far I've seen nothing. Surprise billing, bipartisan legislation passed into law by President Trump. You all own and keep millions of dollars that are owed to providers today that you're not paying them, that have been adjudicated in their favor. That is fraud. You know, United Healthcare, you guys give a wonderful thing that you're going to return Obamacare premiums. I wonder and perplexed whether it would have occurred if these hearings had not been there. But what about the billions of dollars that you've stolen from the American taxpayer but because people were fraudulently enrolled during COVID? I don't see that money coming back. Medicare Advantage. You've made the diagnosis of secondary hyperparathyroidism an amazing thing. 70% of your MA patients have it, while 3% of fee-for-service patients have it. It's unbelievable. You've manipulated medical cost ratios by the way that you pay physicians and the way that you hide money through your PBMs. The vertical integration, you guys own PBMs, you own pharmacies, you own health agencies, physician groups. Good God, you own a bank. Why would an insurance company own a bank? You know, I had a very spirited discussion with Dr. Decker a couple years ago, and I outlined all the Wall Street Journal articles documenting the egregious practices that were going on by United Healthcare. And all he had to say, in an arrogant and audacious manner, was, "We are doing nothing illegal." Well, right now, several of your organizations are under investigation for criminal and civil charges or for misconduct, and we'll see if things are not illegal. I am here with the outrage of the American people. You know, right now, we're trying to lower drug costs. Will each of you, I'd like a yes or no answer, will each of you commit to allowing Trump RX or cost-blood medications to go towards patient deductibles? Mr. Hemsley. I'll take that as a no. Mr. Joyner.
Absolutely. If it lowers costs for Americans.
Thank you. Ms. Boudreau.
For the lowest cost and affordability, we're open to figuring out how to make sure.
I hope it goes towards deductibles. I'll take that as a yes. Mr. Cordani.
Our newest offering would accommodate that, yes, sir.
Excellent. Mr. Markovic, you
Yes.
don't own a PBM.
Yes.
All right, Ms. Young, you get a skip on that one. You know, I don't agree with Mark Cuban often, but we do agree that what needs to happen is that you guys need to be broken up. The vertical integration has destroyed competition in this country. And again, if I had my way, I'd turn all of you guys into dust. We'd start back from scratch. We'd have competition in the industry. We'd have associated health plans, and we would have nonprofit hospitals rather than profit being put over patients. Sadly enough, I'm not naive enough to believe that anything that's been said today is going to change boardroom behavior. I don't think it will happen. The bottom line is profit. And that's what's happened in this country, and this is where the American medical system, compared to the rest of the world, is sad, comparatively. But finally, I am glad that we have a president in the office who doesn't care about special interests, who is willing to confront and tackle what I believe is unethical, unscrupulous, and unprincipled behavior of the American health insurance industry. President Trump has said he's going to do it. I believe he's going to do it, and it is long overdue. With that, I'll yield back with my comments. Prior to recessing, I've asked that members of the audience remain seated while the witnesses exit the hearing room, and I'll ask that this occur right now while the witnesses will exit. As announced, now the committee stands in recess until immediately following the vote series. Thank you.
Pat, go! Yeah.
That's how you do it right there.
Yes, sir.
And that was the first I was concerned we were going to get stuck a little bit.
Hey, Eric. Sorry, we're not going to be able to do this live tap. We are stuck.
And get out and push while you try and go for the hit.
We now take you live. Did you see us almost get stuck 5 seconds ago?
But we didn't because I'm a beast.
The pack attack survived.
We were in like 1.5 feet of snow, I would say. Maybe not that much, but it was at least a foot.
There was slight concern we'd be stuck for this hit.
Slight concern. This is a road that has not been plowed, that's for sure. Carter Landis? Do we have a lost dog?
Where?
I don't know. There's a flyer. I'm trying to figure out what it was on.
Oh.
Unplug that. Why is that like the? It's kind of interesting.
It's really interesting. The whole thing is that he had a relationship with a staff member, but he's there with his wife.
Just leads you to know. Yeah, they had. She knew. They had to know. I don't care what his mental state is. You were so betrayed by that. Why would you be there?
I wonder what my snitch is going to be. 'Cause these weren't as clear as our first dates. Do what?
Just go forward here for a second. Try and find a way to turn them in. I think you can.
I'll just say we're driving through downtown Kalamazoo.
Yeah.
Okay.
Just because we're a tad ahead. I don't want to go down.
Yeah. Good evening, Andy. We're driving through.
You hear that?
Mic check 1 2 3. 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 We're driving through downtown Kalamazoo. Roads are a little more snow covered. Yeah, stay on roads that are snowy.
Better what?
Snowy.
Okay.
Good evening, Andy. We're driving through downtown Kalamazoo. Roads are a little more snow covered. The snow is actually Yeah, good evening, Andy. We're driving through downtown Kalamazoo right now, and as you mentioned, it's definitely more snow covered here. The snow has started lightly falling once again as well, potentially making travel a little slippery, a little slow for your evening commute. But despite all of these conditions we've seen at times looking even worse than they are now, county road crews are doing all they can to keep up and keep us safe. I'm just not sure how long to go when it intros a pack, you know? Like, I don't know if that was too quick or...
No, I think that was fine.
Okay.
It wasn't too short.
Okay, Eric, good. I'm like, it's not a driving live, so...